let's talk about something every single parent deals with at some point: skin infections in our kids. You know, their skin is their first little line of defense against the world, but it's also incredibly sensitive. So today, we're going to break down exactly how to spot the signs, figure out the causes, and most importantly, keep our little ones safe and healthy.
We've all been there, right? You see a little red spot, maybe a tiny rash, and you have that moment of, is this something I need to worry about? Well, the truth is, sometimes, yes. That tiny little spot can be the first sign of something much, much more serious. And that's exactly why we're starting right here, with the big picture consequences. Because an untreated skin infection isn't just, a cosmetic issue. If left alone, it can spiral into some really severe problems. We're talking about things like sepsis, which is a life-threatening infection that gets into the bloodstream, or acute glomerulonephritis, a serious condition where the kidneys get inflamed, or even encephalitis, which is a dangerous inflammation of the brain. The biggest takeaway here is that what starts on the skin doesn't always stay on the skin. Okay, so now that we get just how high the stakes can be, here's our game plan. First, we're going to look at why kids' skin is so vulnerable to begin with. Then we'll unmask the 4 main culprits behind these infections. After that, we'll get practical and learn how to spot the most common ones, know the red flags that mean it's time to call the doctor, and finally, we'll wrap up with the most powerful tool we have as parents: prevention.
So, let's dive right in. What are these hidden dangers? Well, it all comes down to a simple fact. A child's skin is fundamentally different from ours.
So check this out. A child's skin is literally thinner and way more delicate than an adult's. This means that protective barrier they have is just weaker. It makes it so much easier for germs to sneak in. And when you add an immune system that's still learning the ropes, still developing, well, you've basically got the perfect setup for an infection to take hold. Kids aren't just tiny adults. Their whole biology is different, and that's so crucial to remember.
All right, so we know their skin is more vulnerable, but what is it actually vulnerable to? It's time to meet the usual suspects, the 4 main groups of culprits that cause most of these skin infections.
We can basically sort these troublemakers into 4 main gangs. First up, you've got bacteria. These are the microscopic invaders that cause infections like impetigo. Then you have viruses, which can lead to things like chickenpox. You've also got fungi, which just love warm, damp places and cause issues like ringworm. And finally, parasites, things like scabies or lice that actually live on or in the skin. Each one of them poses a totally unique challenge.
Okay, let's get down to the nitty-gritty. Knowing what you're actually looking for is half the battle. So we're going to zoom in on some of the most common infections and their dead giveaway signs. First on our list is impetigo. This one's a bacterial infection, it's super contagious, and it's incredibly common, especially with preschoolers and toddlers. It's an opportunistic too. It often gets in through skin that's already a little broken, like from a scrape or even a bug bite.
So what does it look like? Well, it usually starts as little red spots that pretty quickly turn into blisters. And when those blisters pop, they leak a bit and then form this really distinct crust. And this is the #1 thing to look for. It looks like a honey-colored or golden crust. If you see that, especially around your child's nose and mouth, that is a huge sign that you're probably looking at impetigo.
All right, next up is folliculitis. And this is exactly what it sounds like. It's an infection of the hair follicles. You know, those tiny little pockets in the skin where every single hair grows from. Bacteria are usually the cause, but sometimes it can be a fungus.
The classic look here is a bunch of small red bumps that look an awful lot like pimples, but each one is right at the base of a hair. They might have a little white head on them, and they can be pretty itchy or even a bit painful. You'll often spot them in areas that get sweaty or have a lot of friction, like the scalp, the bum, or along their arms and legs.
And our third common culprit is fungus. We're talking about things like ringworm or a nasty diaper rash. These fungi absolutely thrive in warm, moist environments, which is exactly why they tend to pop up in skin folds or areas they're covered up a lot.
So the biggest clue for something like ringworm is right there in the name. Now, it's not a worm, not at all, but it often creates this red, scaly patch that grows outwards in a ring shape, a lot of times with clearer skin right in the middle. But the one symptom that's almost always there with a fungal infection, it is intensely itchy. So look for it in those warm, damp spots, the diaper area, under the arms, and in those cute little neck folds.
Okay, this is maybe the most important part. You've spotted something. You think it might be an infection. What's next? Knowing when to stop watching and waiting and actually call the doctor is absolutely critical.
So let's go over the red flags you should never, ever ignore.
These signs right here, it's time to get a professional opinion, period. If that rash or infection is spreading fast, if your child spikes a fever, or if the spot itself is getting really painful, swollen, or hot to the touch, make the call. But maybe the most important signal of all is just your gut feeling. If your child just seems off, they're tired, super irritable, not eating, that's their body telling you it's fighting something serious. Don't second guess yourself, get them checked out.
So we've looked at the dangers and we've talked about how to spot the problems. Now we get to focus on the most powerful thing of all, prevention. Let's talk about the simple, proactive steps we can build into our daily routines.
Think of this as your daily defense toolkit. It all starts with keeping their skin clean and, this is just as important, dry. Pay extra attention to those little folds where moisture can get trapped. Remember, any cut or scrape is like an open door for germs, so clean them out right away. Hand washing? Non-negotiable, it stops germs in their tracks. Here's one people often forget. Keep those fingernails short. It means less bacteria hiding under there and less damage if they do scratch. And finally, just keeping their environment clean. Bedding, clothes, toys, it just lowers their overall exposure to all those culprits we talked about.
And for our littlest ones, prevention can actually start from the inside out. There's a really powerful reason breastfeeding is so amazing. It's so much more than just food. It is literally a baby's first immunization, because it's packed with these special antibodies called IgA that help their tiny developing immune systems fight off infections before they can even get a foothold.
So, we'll end on this question. Is your child's skin truly protected? After everything we've gone over today, from the hidden risks to the simple daily habits, you now have the knowledge. The only thing left is to put it into practice every day. Because when it comes to our kids' health, being proactive isn't just a good idea, it's everything. Thanks for joining me for this explainer.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.